Hello, my name is Elizabeth, and I am showing you a demonstration of what I do when I come into work. This is a tutorial for the VetNetSoft, and here we go. So I log on with my username and password. It opens up to the main screen here. Normally we have clients come in and we open up the calendar to check our schedule. We click the day only view. And let's say Snoop is coming in for x-rays, so we left click on Snoop. We right click to confirm that he came into the clinic. Wait for that to load. We double click the appointment to open up his client data card. We verify the owner's name, the owner's address listed here, his phone numbers that he has or an email. If he wants to add or change, we can go here. Say he wants to change it to 1162. Then we verify Snoop's information. Say it was supposed to be Snoopy and not Snoop, and that Snoopy is already neutered. Try to verify the date of birth if you can. If you cannot, then leave it as estimated age. That he is a fawn and white boxer. And if he has a microchip or whenever that was done, you can enter the information here. Save it. Then you're going to move through to the medical record. These are the past medical records that Snoopy has already had with the clinic. Add a new one for today. And then we list the treatment as drop off for x-rays. I always put my initials after everything so that they know that I'm the one that checked in this client for the day. The client is on heartworm prevention. He's updated on vaccines. And I verified this with the client as I'm checking in the patient for the drop-off, that they are a returning client and patient, that he is neutered. And then if they are going to drop off, we normally like to put in a pickup time here. So we'll do pickup at, our clinic closes at 7, so we like to put the pickup time at 6 p.m. so we have time to go over everything and the results with the client before they leave. And then we would do an exam, x-rays, and just in case we'll put a anesthesia on here. Just in case. If we don't have to use the anesthesia, then we will refund it. I'll show you that later. So that's basically it for the receptionist. We check it in there. We also have other consent forms that we have the client fill out, and you would select it here after you scan it into the computer, and then we attach them through here. And you just double click on the picture and it'll show up down here in this area. Once you do that, you send it to the waiting room, and you can put x-rays, a little note for the technicians to see. So that will ding, and it'll also alert the technicians in this area that there is a patient waiting in the waiting room. The technician normally leaves their screen here so that they can check it whenever they need to, whenever there's a client waiting for them. So they check the waiting room, they see that Snoopy is here, that tells them how long Snoopy's been waiting, what time they got here. So they will right click Snoopy's name and move them into an exam room that they're stationed at for that day. So now we're the technician. We double click, but we hit no. If you hit yes, it will remove that patient from that room. So we hit no to leave it pending there so that everyone else knows that that's who they have. And they go ahead and open this up. They type in temperature and put notes, and then the doctor will write notes of abnormalities and what's going on with the patient that they need the x-rays for. And let's see. Then the technicians put advised heartworm prevention, once a month for life, return in 1 year to update vaccines. After they're done, let's say he wanted a refill on his heartworm prevention, so we're going to add a box of HeartGuard there too. And this is where you're going to click to make the label. So give 1 chewable tablet by mouth monthly for life to prevent heartworms. Refill, and we got him a 6-month supply, so we'll say 6 months. And we like to put the doctor who was on the case. right there. And then it says HeartGuard, 26 to 50 pounds for 6 months. We would hit save print here, and it will save the label information as soon as it goes away. There we go. Right here, and it shows them prescription label, HeartGuard. So we're going to save. And then when you're ready to send that patient back to the receptionist to check out for the day, or to leave a deposit in this case because we're doing x-rays, you click this little check mark, and then they're done. We'll delete it out of this room. It'll notify the receptionist here that there is someone waiting in the checkout invoice box. So the receptionist will double click yes to remove it to let them know that they picked them up. It alerts you here with the amount, and you go to basket. Once you see that they have everything here listed that they're going to get for that day, you click make invoice. You select the cash box that you want to use, and you are going to click a deposit because they're staying for the day. You type in the amount here that they're going to pay, and then you list it where they're going to pay it. So if it's going to be cash, you leave it in the cash box. Card, you leave it here. We don't accept checks, so we never use this one. And then in the notes, you write the last 4 digits of the card number with a slash and what card they used, and if it was credit or debit. We like to leave notes on the deposit slip that it was Snoopy Barger, and they are going to pick up at 6 p.m. with your initials. You will close the invoice, hit yes. We like to have a copy for ourselves and a copy for the client, so we like 2 copies printed out. We hit print, and it closes it there, and it shows you the deposit here of how much they've already paid, and their current balance is 0. After that's done, we have to send it to the surgery room. And this is their main folder in the back for the surgeries. We send it there, and they'll send it to the x-ray folder to organize them accordingly. In the surgery room, they would have got a little notification up here like before that shows them that someone's pending. And again, they will double click and hit no to leave it there so that they can go back to it. And it sent Smokey. Hold on one second. To find it, just in case this ever happens to you, sometimes you send the wrong pet, or you send a pet that has 2 patients on it, and there it's not showing here in this box. So you can click this client ID. The client ID is found right here. You hit C546, select that patient, and the patients will pop up here. Go back to medical record, right click it to open it up, and they will leave further notes. Just go here. X-ray evaluation was normal. Discuss further information with client. Refer to, oh, I'm pretty sure I spelled that wrong. Refer to AVS specialist. And then we would list the phone number. So we're going to put the phone number there for AVS and their address. Alright, just in case the client is going to actually go to AVS, then they have their contact information here. And we also like to put information so that we know that we did everything and we completed it. You can put a space here, tab, space, and type in completed. Same here. And you can also attach the x-rays, but I can't show you that from this one. Okay, and after they're done, they exit out of it. And now it's been a few hours, the client's coming back to pay. They will right-click here and send it to surgery pickup so that the receptionist knows that that patient is ready to go home. When the client returns to pick up their patient, the receptionist will right-click it from surgery pickup and move it to the waiting room so that the technicians know that that patient is ready to be checked out for the day. It will again notify the technicians in this window. The technicians will right-click it, send it to their room, and then after they're done, they'll send it back to the receptionist. It'll notify the receptionist. The receptionist clicks it out. They will print out the medical record. Oh, I'm sorry. They will print out the medical record for the client's notes so that they can have a copy of whatever went down. They will print out that invoice. It's already prepaid, so we don't leave any notes here. We just print out a copy of them. Make 2 copies, one for the client, one for ourselves, and that is it.